Okay, good morning and welcome to CCRI's Health and Health Administration Path Day. We are going to be talking with some faculty from the Medical Lab Technology. I would like to introduce you to the Dean of Health Services, Suzanne Carr is here. The Assistant Dean of Rehab Services, is that right, Denise?
Assistant Dean of Allied Health, thank you.
Sorry.
Okay.
And also Maddie Josephs, who is the representative for the Medical Lab Technology program. We are also recording this session. I have not put that in the chat yet, so just be aware if you do not want to be seen, it is okay to keep your camera off. All right, who would like to start? Maddie?
Why don't we have Suzanne and Denise introduce themselves, and that way I can take it from there.
Perfect. Suzanne?
Thank you, everyone. Welcome. I just want to introduce myself. Suzanne Carr. I'm the Dean of Health and Rehab Sciences. I welcome you today. You're going to hear a lot of exciting information, and we're very excited for you to possibly start into this pathway. Very serious, profession, the health sciences. The faculty are very dedicated to the students, and the students work very hard in all of our programs. And we're very available to promote success in our students, and you just need to reach out and we will get you the help that you need. Passing it on to Denise Garrow-Pruitt.
Hello, everyone, and thank you so much for being here. I'm Denise Pruitt. I'm the Assistant Dean of Allied Health, and I am here to help you navigate anything that you need. Student success is what we're all about, and just feel free anytime. I'm usually on the Lincoln campus once we get back, so just come by and see me. Good to see you all.
Thanks, Denise.
Good morning, everybody. My name is Maddie Josephs, and I'm chair of the Allied Health Department. In the Allied Health Department, which is mainly housed in the Lincoln campus and the Providence campus as well, we have 9 programs, 5 degree programs and 4 certificate programs. I also oversee, in addition to overseeing the Allied Health programs, I am the program director for the Medical Lab Technology program and the Histotechnology program. A lot of people don't know what those programs are, because those professions are virtually unseen. But I'm sure that you've all had your blood drawn before, and that blood goes to a laboratory where it's analyzed. And the students in my program, when they graduate, will be those professionals that analyze the blood and determine and give the results to a physician. Because without that, the physician cannot make a diagnosis of anything virtually. Your doctor can't look at you and say that you have diabetes or anemia, and that's just 2 of hundreds of diseases that are diagnosed through a laboratory test. So the laboratory is essential. They are an essential part of the healthcare team. It's just that they have virtually no patient contact whatsoever. So if you're somebody who likes science and likes healthcare, but doesn't necessarily want to have that patient contact, then one of the laboratory programs, that is the Medical Laboratory Technology and the Histotechnology program, is for you. Now, the Histotechnology program is a little bit different. Again, no patient contact, but what they do in the histology department is they take tissues that have been removed, either at biopsy or during a surgery, and they prepare those tissues. It's really a lot of artwork that they do. They stain them and mount them on slides, and a pathologist then looks at them to determine if the tissue is normal or abnormal tissue. Again, very integral part of healthcare, because the physician can never know if something is cancerous or not, or something is abnormal or not, without the work of the histotechnologist. both of these professions are very much hands-on professions. That is that it's not all instrumentation. A lot of it is working meticulously and with a great deal of accuracy, as you can well imagine, with your hands. And the different disciplines are in the laboratory are really quite different. So in the laboratory, we have blood bank, and if you need a unit of blood, then it's the blood banker, which is a medical laboratory professional, who is type and cross-matching the blood so that you can receive that unit of blood. In the chemistry department, we do analysis of blood for a variety of different diseases. As I already mentioned, diabetes is one. Any kind of metabolic disease, kidney disease, liver disease. There are hundreds and hundreds and hundreds of tests that are done in the chemistry department. In the hematology department, we are looking at blood as if it's an organ. So we're determining if somebody has an anemia or a leukemia, for example. And then in the microbiology department, we are culturing our specimen to determine what the cause of the infection is, so that we can tell the physician what that pathogen, what that disease-causing microorganism is, so that the appropriate antimicrobial can be prescribed. So it's a lot of different moving parts, but the laboratory collaborates and ensures that the physician has the correct information to make a proper diagnosis and prescribe a course of treatment. And as I said, the medical lab technology and the histotechnology programs, these two programs, which were health science and very science-based, have no patient contact. The other programs in the Allied Health Department are the imaging programs, which include radiography, and formerly known as an X-ray tech, but the proper term is radiography, ultrasound or diagnostic medical sonography, and that includes everything from doing an ultrasound on a pregnant woman to see the baby, to looking at veins and arteries to determine if there's any blockages present, to doing things like echocardiograms, to looking at thyroid glands, to again, the prospects that are limitless. And then we have two other certificate programs that are imaging as well. One is a CT program, a CAT scan, and one is an MRI, magnetic resonance imaging program. So those are the four imaging programs. We also have a respiratory therapy program, and these individuals work with patients to administer respiratory therapies and work with physicians. If a patient, for example, needs to be put on a ventilator, the respiratory therapist is there to assist in that, to monitor the patient on the ventilator, to treat the patient's respiratory diseases. Respiratory therapists have played a tremendous role over the past year with COVID patients. So for every single COVID patient, there was a respiratory therapist that was right there helping to treat that patient, right on the front lines with that patient. So what I just described to you they're all very much hands-on patient contact careers. And then we have a phlebotomy program. A phlebotomists are the people that actually obtain your blood. They draw your blood to do a venipuncture. And of course, there's patient contact there, and that is associated with the laboratory side. And then we have a renal dialysis tech program, and that's also a certificate program. And the renal dialysis tech, I can tell you, for many of these, in addition to medical lab and histotech, there is a critical need for these individuals. For medical lab technology across the nation, there is a critical need. It's the same for histotechnology. I can tell you that I get emails, multiple emails on a weekly basis from either recruiters or from institutions that are looking for graduates of the program because there is such a shortage. So with that shortage comes a lot of opportunities to get a job, to start your profession and also to continue. These are all stackable credentials. So for the medical lab technology program, there are multiple ways that you can continue on to get your bachelor's degree, to get your master's degree, and there is even a DCLS, a Doctorate of Clinical Laboratory Science. And these people are part of the healthcare team that rounds with physicians on a daily basis and provides information to physicians regarding the laboratory, which tests to order and how to interpret those tests. So it's a brand new field, maybe 3 or 4 years old, and there are probably around 12 practicing DCLS, Doctors of Clinical Laboratory Science, practicing in the United States right now. So again, your prospects are limitless, but I can tell you that if you enter the medical laboratory technology field, the chances are very good that you can start your profession right away with your associate's degree. I have 17 students currently in clinical that are graduating in May. And of those 17 students, and they're not done yet, they won't finish until May, but of those 17 students, 14 of them have already been offered a position in the hospital in which they're performing their clinical experience. So that is tremendous. I mean, to know that as soon as they graduate, they can virtually start the next day. They still have to take their certification exam. There's a national board exam that they have to take and pass, but they can start their positions right away, which is so good to hear. So I do have just a brief video to show you. It's just 2 minutes long. And I want to just tell you that this video was produced by the program at Michigan State University. And so what you're going to see are some older individuals, but I can assure you that there are a lot of young people that are entering this field. And as a matter of fact, the American Society for Clinical Laboratory Science has a whole forum that's made up of developing and ascending professionals. And those developing and ascending professionals are now outnumbering the rest of us older individuals. And I know that because I'm the president of the American Society for Clinical Laboratory Science, the national organization. And I work with these young people all the time on initiatives and advocacy issues for our profession. So let me just share with you this quick, brief video about medical, and you need to let me know if you can see this, Shannon.
Yes, we can see it.
Great, thank you.
Thanks.
You love science? Does the human body fascinate?
Probably need to bring up the volume a little bit, Maddie.
Laboratory career? We asked medical laboratory professionals, what do you love about your career? This is what they said.
Hi, my name is Dave Karen. I'm the Medical Director of Clinical Pathology at the University of Michigan, and I can hardly wait to get to work every day. And I get to work with some wonderful people too.
What I love about my job is solving puzzles. Every day there's a new puzzle.
This is where you can see science meets medicine.
I like math and science, and I fell into this career, and I love it because it's ever changing and it's always interesting.
It provides me with career opportunity with very challenges and very rewarding at the same time.
Hi, I'm Suzanne Butch, and for 40 years I was in the blood bank and transfusion service, and now I'm in the Department of Healthcare and Quality Improvement. Now, what do I love about my career? It changes all the time. If you look back over those 40 years, you'll see even in blood banking there's innovation and change and automation. What a wonderful career.
I really enjoy learning the new techniques and new technologies and testing platforms that are constantly coming into the clinical laboratory. And finally, I really enjoy mentoring students and creating the future medical laboratory professionals that will become my colleagues one day.
We have fun, we love what we're doing, and we help people. What could be a better job?
So that was just a brief look at the laboratory. You saw a lot of technology in there, a lot of instrumentation, but I can tell you that a lot of it is very much hands-on and interpretation. And the program itself is quite rigorous. It is science and math-based, but it is extremely promising for a lot of people. And you can see the people that are in the profession are very passionate about it, as am I.
So Maddie, could I just ask you, what kind of students do you think that they would excel in this field? Or they need to bring with them?
Right, so students who like science, basically. So if you like science, if you like healthcare, medicine, but it's not nursing that you want to do, or any of the other allied health programs, and you don't necessarily want the patient contact, because a lot of people like science and they like medicine, but they don't necessarily want to have the patient contact, then this is the appropriate field.
Okay. Do we have any questions for Maddie out there? Any of our participants? Or for any of the other panel members? You can just either put it in the chat, or if you just want to speak it, you just need to unmute yourself.
Hi, Kayla.
Hi. I don't know if it's so much a question, but like, so I'm actually in the nursing program right now. I'm in my first semester and possibly starting to realize that I'm not really into the patient care part. Love science and math. Have always had a passion there. Love medicine and like human body, anatomy and physiology and microbiology. Love those classes. Now that I've gotten into the nursing program, not loving it so much. And I'm really struggling with like, is it because this is like not a great semester for me? Do I just stick it out, or do I really like, make the switch? Definitely the lab is interesting to me. A lower pressure environment, not alarms go. I just had my first clinical day yesterday and it was like, oh my gosh, it was so crazy. Really stressful. Anyway, it's hard for me trying to decide what to do, and this may not be in the scope of what you guys are here for today.
No, I totally understand, and it is I totally hear what you're saying, and I went into this field for the same reason. I love science, I love medicine, I love helping people, but I didn't necessarily want the patient contact so much, not because I don't like people, but I tend to kind of bring it home, like, so I didn't want to have to do that. And if this sounds like you and I have to have another conversation, and I can certainly share more resources with you, and even have you speak to some of my students, because if you're saying that you love science, and it's more than just looking at microscopes, as I said, and working with instrumentation, you actually have to look at those results. And before you report them out, you have to determine if they make sense. Are they making sense with one another? Are they making sense with the patient's clinical picture? So it's all encompassing. You don't see the patient, but you see their results. You know what their diagnosis is, and you're helping that physician. You're solving a puzzle for that physician, basically. Okay. Because without those results, more than 75% of diagnoses are made by a laboratory test. More than 75%. The other is imaging and EKG and EEG, things like that. But that's a tremendous amount of diagnostic responsibility coming from the laboratory. And I don't mean to tell you that it's not high pressure or high stress, because it can be. It certainly can be. If you're that tech that's on, at 2 o'clock in the morning and there's a mass casualty and you're in the blood bank, you have got to be on point, and you've got to get the right types of blood out to the ER or the OR, wherever that blood is needed. So it can be, that doesn't happen every day, obviously, but it can be high stress, but I will tell you it's very fulfilling,
Mhm.
extremely fulfilling, because you know that on the other side of that tube of blood is a patient that you're helping.
Mm. Yeah. Yeah,
Maddie,
I would
can
love to talk about it more.
Chime in, Kayla. I'm so sorry to interrupt you. It's Suzanne.
Oh, that's okay.
I just wanted to tell you that you're showing a lot of courage, because to notice this very early on is very important. I can tell you, and Shannon can also attest to this, is that we do get the students that are further along in the program or even graduate, and we talk to them, and it's not for them. So so you're early enough, and you're identifying this. And then working with Maddie and even you know, folks in the nursing department, even going to your professors, let's, you know, talk it out. You're identifying your needs. There is a pandemic. It's not the easiest time to be a student in any of our programs. You did pick the one that is a tough one with the you know, the agencies and the hospitals and a lot of restrictions. But you have some time, and there's a lot of people that we can get you to talk it out. But I commend you on realizing it might not be for you.
Thank you. I'm really struggling because like this has been a dream for quite a while, and I've worked really hard towards it. And now that it's here, it's like, oh, maybe this is not right.
So, yeah, so Kayla, I just put my email address in the chat so you can write it down. But the good thing about this is that you've not wasted a whole lot of time, because the courses that you've taken in preparation for the nursing program can certainly come into the MLT program. And I can take a look at that, and I can just say, we'll just, if these are the gen eds that you needed for MLT, then, we can make sure that you get the credit for those gen eds. So it's not like you've wasted a whole lot of time or resources, money, whatever, to figure this out. The nice part is that we can just have you, if that's your choice, come right into the MLT program.
Okay.
There was a question from another attendee. How competitive is it to get into these programs? What do you need to get in? I will tell you that right now, and this is my problem, people don't know about these programs, so they're not terribly competitive to get in. And there's room now for we just accepted students for both programs, MLT and Histo, for September, and there's still room. We'll have another application period in June. So there's still room for a September start. What do you need to get in? The application requirement for the MLT program is general biology. Now, there are other gen eds, but that's the only one that you need to be able to get into the program. If you've not taken general biology, but you've taken anatomy and physiology, that's perfectly fine. I'll just do that substitution. For the Histotechnician program, you need anatomy, biology 1070, which is anatomy and physiology, and you need chemistry 1010 or 1030. But again, a lot of students have taken those courses in preparation for other programs. And if there's something similar, like if you haven't taken biology 1070, but you've taken anatomy and physiology 1 and 2, that's just a substitution that I do to allow you to apply to the program. So it's not, that won't be a problem.
So I would also recommend, Maddie, I'm sure that you would as well, that Kayla, you should come to, we have radiology and diagnostic sonography coming up next, starts at 11 o'clock, and then followed by dental, right? So I'm not sure if it's just the patient care aspect that you're not interested in, or you just don't like the nursing patient care. But it's great that you're here for this one, but I would encourage you as well to go to some of the other ones and just explore. It's a great day for exploring the different options that we have at CCRI.
Yeah, thank you. Will those be recorded and posted at some point? Okay, great. Thank you.
Everything is recorded. It should be posted, I'm told, by the end of the day today or tomorrow morning. They should be up on the path. Okay.
And I just want to point out, and I'm not trying to dissuade you from, you certainly should go to learn more about those programs, but those programs are filled to the wall already. Just letting you know that if it's a career or a program change that you have in mind and you want to get underway with that, the ultrasound and radiography programs are full already.
That's really
Respiratory is
helpful
not.
information. Thank you.
But please feel free, Kayla, to reach out to me and whoever the other attendee is. My email is there in the chat, and I will be more than happy to provide you with more information on any of the programs in Allied Health.
Thank you so much.
You're very welcome.
Okay. Are there any more questions before we end? Okay. So I just want to thank you for joining us today. I want to also just give a shout out to the website, so where you can see these recorded sessions and or join us at another session today, ccri.edu/pathways/pathdays. And then as well, next week, we have a virtual job fair on April 14th, and you can see the link there. It also will be on the Pathdays website. There's a link for that as well. We're expecting, I think they said 60 plus employers will be coming.
That's great.
So it's hosted by Handshake, which is, if you did not come to the career services, I would encourage you to look at that recording. Career Services went over Handshake, which is a place where our students at CCRI can go to look for jobs that employers are looking for. So I'm sure there are plenty of medical lab technology jobs there, since they're reaching out to Maddie already.
Yes.
I would encourage you to look at that Career Services recording as well. All right, thank you for joining us and have a good day.
Thank you all. Bye-bye.
Bye.
Thanks, Shannon, for setting this up. I appreciate it.
Thanks, Maddie. Thanks for your help.
Okay, you're welcome.
Okay.
Bye-bye.